turf wars are real. Vascular surgeons are constantly battling interventional radiologists for endovascular procedures. You're on your surgery rotation, and the cool kids are talking about matching into neurosurgery and orthopedics. Someone mentions vascular surgery, and the room goes quiet. Uncomfortably quiet. Here's a specialty that saves more lives than most, pays over $500,000, and desperately needs doctors. So why is it treated like surgery's unwanted stepchild, and why didn't I choose it? Let me start with what actually impressed me about vascular surgery. First, vascular surgery is high-stakes medicine. When these doctors get called, someone's life is literally on the line. We're talking ruptured AAAs, acute limb ischemia, massive bleeding, real emergency medicine. This isn't like dermatology where you can schedule everything out weeks in advance. When a vascular surgeon gets paged at 3 a.m., it's because someone's life is on the line. If you're the type who gets energized by pressure rather than paralyzed by it, vascular surgery delivers that rush of excitement. What's fascinating about vascular surgery is how it perfectly balances traditional surgical skills with new tech. You're literally getting the best of both worlds. The endovascular revolution has completely transformed this field. One day, you may be doing an open aortic reconstruction, classic big open surgery that requires serious technical skill. And the next day, you're threading a stent graft through tiny incisions using advanced imaging and robotics. This isn't like other specialties where you're either a tech person or you're not. In vascular surgery, you need both skill sets, and that variety keeps your career intellectually stimulating. The technology is constantly evolving too, so you're never stuck doing the same procedure the same way for decades. Now, let's talk numbers. The 2025 workforce study shows vascular surgery has a severe shortage problem. Workforce adequacy is only 73.7%, and it's getting worse. By 2037, that's projected to drop to just 64.3 adequacy as demand increases to 9,000 surgeons. Vascular surgery actually ranks dead last in workforce adequacy compared to all other surgical specialties. And basic economics tells you what happens when demand outstrips supply. Compensation is high, and that's exactly what we're seeing. Vascular surgeons make an average salary of over $550,000, in the top 10 for compensation of over 50 specialties and subspecialties. Not bad for a career path that's not on many people's radar. This shortage is driven by our aging population combined with a limited supply of trained surgeons. And if you're willing to work outside of major metropolitan areas, the geographic shortages are even more severe, which means even better opportunities and compensation. There's clearly strong demand for vascular surgeons, though, as we'll discuss later, the job market is more complicated than these numbers might initially suggest. Another aspect that appealed to me was the intellectual challenge. Vascular surgery doesn't only involve technical skill. It's about creative problem solving with some of the most complex anatomy and pathophysiology in medicine. Every case is like a puzzle. You're dealing with unique vascular problems that require custom solutions. Maybe it's figuring out how to revascularize a limb when all the obvious routes are blocked, or planning a complex aortic repair when the anatomy is completely distorted. And it's not just surgical, you're combining medical management with surgical intervention. You need to understand pharmacology, hemodynamics, imaging, and surgical technique all at once. The techniques and technologies are constantly evolving, so you're always learning something new. Next, just like what drew me to plastic surgery, there's also something deeply satisfying about the precision required in vascular surgery. We're talking finer than millimeter level accuracy when you're connecting vessels and grafts. One small mistake and you've compromised blood flow to an entire organ or limb. If you're someone who enjoys meticulous, detail-oriented work, like I do, vascular surgery delivers that in the highest stakes environment possible. There's real technical satisfaction in creating perfect anastomoses and knowing that your precision directly determines whether the repair will last for decades. That combination of extreme precision under pressure is not for everyone, but for the right surgeon, it's incredibly rewarding. Next, I'll cover what I did not like about vascular surgery, but if you're new to this channel, this is my Why I Didn't series, where I take a deep dive into the pros and cons of choosing one specialty through the lens of what I experienced and preferred about the specialty, and ultimately why I did not pursue it. If you're looking for more objective facts shared by real vascular surgeons, then check out the So You Want to Be a Vascular Surgeon video on the Med School Insiders channel, which breaks down everything from training pathways to lifestyle to day-to-day responsibilities, again, in a much more thorough and objective way, not my subjective take. Now, let's talk about why vascular surgery was not for me. I'll be honest, my exposure to vascular surgery during medical school was pretty limited. which is actually a huge part of the problem for many med students. Medical school does a terrible job of helping students discover some specialties. Vascular surgery wasn't even on my radar when I was in med school. When people both inside and outside of medicine think about surgical fields, they think about the sexier, more commonly known ones. Things like, of course, neurosurgery, orthopedic surgery, plastic surgery, and I actually chose electives in those three. Those are the three that I was considering the most. But vascular surgery, not really as well known. And even when you do hear about vascular surgery, many medical schools don't offer dedicated rotations for it. It gets lumped into general surgery without providing any specific vascular experience. And this definitely shapes your experience and your interests. So it's really two things. The first being getting exposure in your rotations, but the second thing, you're not getting exposure from the people around you even talking about it. It's nearly impossible to know if you'd like the day-to-day of being a vascular surgeon without exposure to it. In med school, you have to go out of your way to secure those experiences and that exposure. And then also keep in mind there's two pathways, right? So if you wanted to do the independent pathway, you would just go to general surgery for 5 years and then do vascular surgery for 2 years, 7 years total. That you don't have to decide until you're well into your general surgery residency. But if you want to do the independent pathway, which is only 5 years and is just dedicated vascular surgery, you have to do that straight after medical school. And it's a lot harder to know that right out of med school if that's the right specialty for you. All right, next, let's be brutally honest about what the lifestyle actually looks like. And this is probably the biggest downside for me. I've been speaking with practicing vascular surgeons and the reports are sobering. First, there are the Q2 call schedule. That's every other day you're on call. And one surgeon actually shared with me that he went on call for 17 days straight. These aren't just regular call either. I mean, we're talking about middle of the night emergencies that genuinely cannot wait until morning. I mean, ruptured aneurysms don't care that it's 3 a.m. on a Sunday. Vascular surgery is absolutely not a lifestyle specialty. The work-life balance of a vascular surgeon leaves much to be desired. Speaking of brutal lifestyle, there's the incredible irony in vascular surgery. Vascular surgeons spend their entire careers fixing the consequences of metabolic dysfunction, diabetes, atherosclerosis, hypertension, but their own lifestyle makes optimizing their metabolism nearly impossible. I mean, think about it. Q2 call schedules destroy your circadian rhythm, and sleep disruption is one of the worst things you can do for your metabolic health. Those 3 a.m. emergency calls spike your cortisol and stress hormones, which directly impacts your insulin resistance as well. Then you have the irregular eating patterns during long cases. You're either stress eating or missing meals entirely. Every diabetic foot amputation, every coronary bypass graft, you're seeing the end result of poor metabolic health daily. But as a vascular surgeon, you're trapped in a lifestyle that makes it extremely difficult to optimize your own. And glucose is just one piece of that metabolic puzzle, but it's the canary in the coal mine if things are out of whack. You're seeing patients with advanced cardiovascular disease, and you wish you could have caught the warning signs years earlier. My own health was completely neglected during residency training. When I was in residency, CGMs weren't available to the greater public like they are now, so I had no clue what that brutal schedule was doing to my own metabolism. It wasn't until years later, when I started wearing a CGM, that I could see in real time how my sleep deprivation and stress was wrecking my blood sugar, which was again a proxy for my insulin resistance. And since I wasn't nearly as sleep deprived after leaving residency, I can only imagine how terrible my metabolic health was during those med school and residency years. That's why I actually sought out levels personally before they even launched. And ever since, I've been hooked on the deep insights I can access about my metabolic health using a CGM. What I really like is that they've started integrating lab work with the glucose monitoring. You can get labs done at any LabCorp or Quest, and instead of having your glucose data in one app and then your lab results kind of scattered across different doctor portals, it's all going to be in one place. And the lab testing they're doing is much more thorough than what you're going to receive from your annual physical with your doctor. Your metabolic markers, cardiovascular health markers, and inflammation levels, it's all there where you can actually see the big picture. And if you're not super deep into this stuff or you don't have prior medical training, which again, most people don't, your results are shown in a clear snapshot of what's in range versus out of range. You're not looking at complicated lab results that only give you numbers, not context that you can actually act on and understand what's going on. So it's designed for anyone to understand, and more importantly, it's designed for anyone to track their progress. That's the true and deeper benefit of a tool like Levels. Since they have the habit tracking built into their app as well with the CGM, you can see how these things combine to affect your results and how positive or negative lifestyle changes actually impact your progress. And that tight feedback loop is the ultimate secret to behavior change. So if you're interested in checking it out for yourself, head to this link right here where you can get an exclusive discount, link also down in the description. All right, now another downside of vascular surgery is that the turf wars are real. Vascular surgeons are constantly battling interventional radiologists for endovascular procedures. Meanwhile, interventional cardiologists are encroaching on peripheral interventions, especially in cardiac centers where they already have natural advantages through existing referral patterns. And honestly, interventional radiology might actually be taking the good stuff. They get to do many of the same minimally invasive procedures with better lifestyle, similar pay, and in some cases, better outcomes. As procedures become less invasive, more specialties want to claim them. They want a piece of that action, and why wouldn't they? Now, this is very different from what we see in primary care, where mid-levels like nurse practitioners and physician assistants are pushing for independent practice. Surgical specialties like vascular surgery have natural barriers to that kind of scope creep. It'd be pretty shocking if mid-levels started arguing that they should be qualified to do actual surgery. But you will see more hospitals hiring mid-levels for vascular teams, but they're handling pre- and post-op care, rounds, and basic procedures under physician supervision. And in the operating room, they're ever only first assist. But what's frustrating about the whole situation is that vascular surgery desperately needs more surgeons, but instead of training more vascular surgeons, other specialties are just competing for the same cases. When it comes to the patient population, you're treating very sick, high-risk patients with multiple comorbidities. And personally, this was one of the aspects that turned me away from vascular surgery and several other specialties too, like even neurosurgery. We're talking about advanced diabetics with end-stage vascular disease, people who've neglected their health for decades. And many of these patients have poor prognoses despite your best interventions. You're often operating on people who are in terrible medical condition because the alternative is certain death or amputation. Some people don't mind this, but I know for me, the emotional toll of negative outcomes, it can be very significant. You're constantly dealing with patients who are facing limb loss or death, and sometimes there's only so much you can do. And if you're finding yourself having to give bad news to families day after day, at some point that's going to weigh on you, or at least it did for me. There's also something about vascular surgery that isn't immediately obvious. At first glance, it seems like you get great variety. You're working all over the body, from carotid arteries in the neck to peripheral vessels in the legs. But when you really think about it, you're only really working with vessels. And the only time you're not working with vessels is when you're trying to get to the vessels. But if you look at something like plastic surgery, you're operating on fat, skin, muscle, and yes, even bone. That to me is true anatomic diversity, and one of the reasons that I was drawn to plastic surgery. In vascular surgery, you're always dealing with arteries, veins, and grafts, and you work around other structures to get to the vessels, but you're not actually operating on those other tissues. It can feel repetitive compared to specialties with genuine tissue variety. And if you're someone who thrives on working with different structures and surgical techniques, like I did, that limited scope might bother you. And it might not even be something that you notice at the beginning because you're training. Everything is fresh, new, and exciting, but you have to think beyond to your long-term career. Will you be happy with this kind of variety 10 or 20 years from now? And for a lot of people, it's not an issue. But again, I know for me, that would bug me. We got one more point left, but before we get there, drop a comment below and tell me what specialty should I cover next on this Why I Didn't series. The most suggested topic will be prioritized for the next video. All right, so lastly, let's talk about training demands and competitiveness. This wasn't really a contributing factor in my decision since I was already looking at lengthy surgical residency programs, but it's worth noting here. So compared to many specialties, the training demands of vascular surgery are extensive. There are two ways to become a vascular surgeon, and both have their challenges. So again, there's the integrated route where you go straight from medical school to a 5-year vascular surgery residency. And the main challenge here is knowing whether or not you're ready to commit to that specialty at that time, since you probably won't have that great of exposure. The second option, the independent path, is again Gen Surg for 5 years, followed by a 2 to 3 year fellowship in vascular surgery. So your total training is going to be 7 to 8 years long, and that's essentially the same or even longer than neurosurgery, which is the longest training of any specialty. Now, this integrated and independent path applies to other surgical specialties too. Like for plastics, as an example, I matched into an integrated 6-year program rather than doing 5 + 3 for plastics. So you save 2 years and you get additional years just in plastics rather than having to do general surgery. So anytime you look at independent versus integrated, the integrated path is going to be more desirable and a lot more competitive than going the independent path because you're going straight through and you're saving time. So essentially, if you know in med school what specialty you want to do, you should always do the integrated path. The only time people do independent is number 1, if they weren't able to match into the integrated path, or number 2, they weren't sure they wanted to do that until they were in their general surgery residency and then they were like, hey, let me look at fellowship options and oh, this thing seems appealing. So those are really the only 2 situations where you would not do an integrated and you would do independent instead. So even though integrated vascular surgery is more competitive than independent vascular surgery, the good news is that as far as competitiveness goes, the integrated path, again, the more competitive of the 2, is still around just the middle of the pack. It's way more attainable than other surgical specialties, ranking 9th most competitive out of 22. And I know a lot of you might be up in arms say, hey, vascular surgery is way more competitive because of this metric or another, but when you're talking about competitiveness, if you focus on only one single factor, I get it, it's easier. It may give you the answer you want, but it's an incomplete and not true answer. The truth is that if you follow just one metric, you're never gonna get a fully accurate portrayal. You need to focus on a range of factors like step 2 CK scores, match rates, research items, and so on. And myself and the team at Med School Insiders, we compiled all these factors into a free index. It's the only robust data-backed ranking of specialty competitiveness, and it uses official NRMP data. You can access that analysis completely free from the link in the description. And you can play around with the data, even look at prior years on Compare. It's very useful stuff to have it all compiled in this easy to understand format. Lastly, should you consider vascular surgery? You could be a good fit for it if you love high-stakes environments, thrive under pressure, and are game with the unpredictable schedules. If you're fascinated by complex anatomy and cutting-edge technology, and you want to make an immediate impact on patients, vascular surgery could be perfect for you, but you need to be comfortable working with very sick and high-risk patients. The years of training are demanding, but if it's a field you're interested in, the over $500,000 salary, it's not bad either. And if the prospect of being faced with a ruptured aorta at 3 a.m. excites you rather than terrifies you, this might be your calling. Now, to dig deeper into vascular surgery, including the bread and butter cases, misconceptions, and specialization options, check out this So You Want to Be a Vascular Surgeon video right up here.